I wanted to ask you about something, Shimon, because the president on Twitter attacked Governor Cuomo. He claimed that thousands of federal government ventilators were found in a New York storage facility and that the state must distribute them now. You were talking to Governor Cuomo just a short time ago, and you asked him about this, and he essentially gave you a fact check. What did he say?
He did. He said it was ignorant for the president to say something like that. The fact that there are these ventilators, of course, they're there. They're there so that they could be distributed when they are needed. Here's exactly what the governor said, Brianna.
That is incorrect and grossly uninformed. The point is, we have ventilators in a stockpile, and we didn't send them to the hospitals yet. Of course we didn't. That's the whole point. The hospitals don't need them yet. The hospitals aren't at their apex. The hospitals have enough ventilators today, but the numbers are going up. We're planning for an apex, a high point in about 21 days. That's when we need the 30,000 ventilators, not today. Right now, we're putting them in a stockpile. So the point is, well, they're in a stockpile, you must not need them. It's just ignorant. Of course you don't need them today. You need them when you hit the apex, which is 30,000. We're not there yet.
And Brianna, this is exactly what the governor has been talking about. He wants to stockpile these so that when they need them, they can have access to them so they can move them around the state, around New York City. We're hearing stories already from hospitals that are saying that they're going to need more help, that they're feeling the burden of this virus, that there are too many people at some of these hospitals, and they do anticipate things to get worse. And all the governor is saying is we need these ventilators so that we can move them around when the time comes. The governor says he still wants more ventilators. He's hoping to get that. The apex, as you said, 21 days. And they're still working to make sure that hospitals have everything they need, the gear, the protective gear, and obviously those ventilators, Brianna.
Yeah, Brookdale University Medical Center in Brooklyn saying they are down to the single digits in ventilators, and here we are 21 days away. It's stunning. Shimon, thank you so much for a look inside what's really a field hospital inside a convention center. Thank you. And as President Trump publicly pushes to reopen parts of the country, claiming that some states are at a low risk, Microsoft co-founder and philanthropist Bill Gates is warning against that idea, saying that social distancing must be the country's top goal nationwide until the number of cases goes down. So here's what he told CNN's Anderson Cooper and Dr. Sanjay Gupta last night.
So we're entering into a tough period that if we do it right, we'll only have to do it once for 6 to 10 weeks. But we have to do it, it has to be the whole country. We have to raise the level of testing and the prioritization of that testing quite dramatically in order to make sure we go through one shutdown so that we take the medical problem and really stop it before there's a large number of deaths. We do then get an economic problem, which is why you want to minimize the amount of time. And having states go at different things or thinking you can do it county by county, that will not work. The cases will be exponentially growing anywhere you don't have a serious shutdown.
Dr. Gavin McGregor-Skinner is an epidemiologist and infectious disease expert. He joins us now along with Elizabeth Cohen, our CNN senior medical correspondent. And Elizabeth, to you first, CNN has learned that these plans to reopen states, they're not yet finalized, but just walk us through what the president is proposing.
Well, you know, he's being very vague, actually, in what he's proposing. He's saying maybe divide the country into quadrants, maybe go county by county. He's being very vague about what he's thinking of. I guess the general feeling is not everyone needs to shut down. The term county by county, the experts I've been talking to, that makes them really bristle. Like, people go from county to county. Why would you shut down one county but not the adjoining county? People travel from county to county. They can easily spread it that way. So that certainly seems too microscopic. Now, whether or not to do that on a larger scale, you know, as Mr. Gates said, if you shut down the whole country, you may actually get the economy up and going earlier because you can stop this thing now. But I think the underlying thing that I'm hearing from people is this, Brianna. They want to hear the president talking about science. They want to hear him say, according to the numbers that we're seeing, we should do X. According to the testing data, according to the number of hospitalizations, we should do this. And that's not what he's saying. It doesn't seem like he's making a data or a science-based decision. He's just making a decision. I want to get the economy going again. That's not data-based. That's not science-based.
Yeah, because you have to know what the problem is before you can solve it. It's pretty basic. And Dr. McGregor-Skinner, I wonder if, you know, when we hear Bill Gates say this, he's talking about shutting down for so many weeks. Do you agree with that?
What's happening at the neighbourhood level, the community level, even the county level, Brianna, we've created resilience zones. And those resilience zones are trying to keep the virus out. And we know the only way the virus moves across the country into different towns, different neighborhoods, is by people movement. And we know that it's not everywhere. So we're using lots of maps. Right now we're reporting where people are showing any types of respiratory symptoms, and we're putting those dots on the maps, and we're letting everyone in that neighborhood that this is what you've got or you haven't got any patients. So we're actually trying to create resilience zones to keep the virus out, not just focus on flattening the curve.
But would you think of a shutdown, a nationwide shutdown for that long? You think that's totally reasonable?
Right now, my focus is on training in hospitals. I've been in a lot of hospitals in the last 2 weeks where I'm focusing on provider safety, the frontline health workers' safety. And what I'm seeing, though, is that all the communities, all the neighbours are actually trying to protect the integrity, the functionality of those hospitals. Now, again, shutdowns, it's not my area of expertise. I focus on hospital safety. But what I'm seeing, though, is that as people are not going to work, they're coming together as a community to help to protect the hospital and the hospital staff, and also decrease the amount of virus being transmitted in their community.
So let me ask you then, Dr. McGregor-Skinner, about if you're talking about protecting hospitals and we're looking at them becoming overwhelmed and there's going to be staffing issues, what do you want to see done when it comes to medical students who are supposed to be graduating soon, right? And what do you want to see in terms of folks being trained on how to use respirators, because that may be something that's in shortage?
It is, Brianna, and we are training every day, even during the outbreak now. Again, I teach and train in disaster medicine. I've done that now for over 25 years. Even during the disaster, you still train people as you get volunteers, as you get people within the hospital system, as well as those that have been retired, as well as new graduates coming from universities. We train them in the proper ways of safely putting the PPE on, taking off, but also in using other medical equipment. So that training is ongoing every day in every hospital in the country right now. We're doing it by face-to-face. We're taking these large paper documents that are produced by the CDC, the HHS, and we're turning them into YouTube videos so people can watch them in their own time, and because everyone learns by doing. And instead of focusing on the healthcare system focused by reading, we're learning by doing, and we're training probably people in the thousands right now to fill in the necessary gaps on our front lines.
All right, Dr. McGregor-Skinner, thank you. Elizabeth Cohen, thank you so much.